because people become actually aware of your work. So she had placed her work on body donation in Denmark, not in a journal within the social sciences, in the European Journal of Anatomy. And this is where I came across your work in 2016 in an article that you published with your mentor, Klaus Hoyer. The article is called Meet the Donors, a qualitative analysis of what donation means to Danish whole body donors. And this work then became a field of anatomy finally visible to me. I try to look at other places, but it's much easier when others come to us. And I then realized that she and I apparently had been working in parallel and thinking in parallel over the last 3, 4, 5 years. Actually share a lot of ideas, thoughts, and hopefully in the future outcomes of our research. Concerning anatomy, the education of anatomy, knowledge gain in anatomy, perception of anatomical patterns, and so on. Also, the idea of what body donors actually think when they decide to donate their body to science. We've all done work on organ donation, right, which is different from whole body donation, of course. In today's talk, Maria will explore the relationship between anatomy and society through both a historical and contemporary perspective, and through looking at new developments within anatomical science. We'll present some of her historical research, as well as some of her work that is based in ethnography in the lab and interviews with donors. Thank you very much. I'm looking forward to it, Maria.
Thank you. I will start from Right. Hi, everyone. Thank you, Sabine, for the introduction. Thank you for coming today. Very grateful for having the opportunity to share some of my work with you here today. To plan my talk short enough that we have some time to discuss these matters as well, I'd really like to kind of hear your ideas as well. As Sabine said, my talk today about anatomy in Denmark, basically use of dead human bodies in education and research, and the pictures that you will see throughout my talk from one of the anatomy labs in Copenhagen. The outline of what I want to go through today. So I'll start by telling you a little bit more about my research interests and why I find the field I study relevant, why I find it interesting. Provide some background information on Denmark and on medical education in Denmark. I delve into kind of core of my talk, which consists of different perspectives on anatomical dissection. And then to conclude on that. So, what I'm interested in is what you might call the culture of medicine, but also medicine in culture. And by that is that I'm interested in the relationship between society and medicine. And more specifically than the thing that I study is that of anatomy, because I think it's an example of a place where these relations between society and medicine can be studied empirically instead of just conceptually. So, as on anatomical dissection in Denmark, focusing both on the society for dissection and on dissection practices, and taking both a historical and a contemporary view. Work, that's all. There you go. Work has been part of one research group called By Person, and is now part of this new research group that Sabine also mentioned on policy aid, which goes more into big data movements and intensified sourcing. I won't go any more into these projects. If any of you kind of work on the fringe of what these projects center on, you're welcome to ask me later. I can maybe also put you in contact with people back home that might be interesting for you to talk to. Anatomy interesting, you might ask. So, as I said, I find it interesting as a venue of exploring medicine and society or culture interact with one another. And the reason I find anatomical to be such an interesting case is that even though it's a really old practice, even though it's an integral part of medical education, it's an integral part of medical history, it still kind of exists at the fringe of society. It's hidden from view, it's a bit taboo, and it would seem like it's not part of society, but of course it is. So connection to society then is what I'm interested in. What do these connections look like? What I try to do is divide into conditions and implications, so that on the one hand, how anatomy is shaped by various national, historical, and societal conditions, but then so what kind of social and cultural implications an dissection has for society. That I'm interested in both the social backdrop and the social effects of anatomy. And exploring a practice like anatomy, for me, can teach us not just about anatomical dissection, but actually about society, the way we view bodies, the way we deal with the dead, things like that. So kind of view on anatomy, the national context is of course important. So what I've done should not be considered exploration of anatomy everywhere, but an exploration of a very particular time and place. So a little bit about that context before we go any further. So Denmark, and I've studied these anatomy in Denmark, and some of you might already know a thing or two about Denmark. You might have seen pictures of any beaches, might have seen pictures or maybe even visited Copenhagen, maybe about our famous or infamous, maybe even sierras. You've seen or enjoyed our cuisine, very difficult to say. It's also a test that we give people, in terms of if they've learned the language or not.
I thought that was Swedish.
That's Danish. That might be a contested, I'll just say it, it's Danish. Okay. You might also have heard about our famous author, Christian Andersen, or that we regularly score as the happiest nation in the world, which was...
Didn't you lose that this year?
Yes, we lost it this year to Norway. Terrible. Yes. And of course, this view of the world's happiest nation was something that our also world famous beer company Carlsberg was quick to try to take credit for. This is actually a picture from Copenhagen airport. So when you arrive, you met with this strange, this kind of sign. If a more serious approach, it's a small northern European country with a population of about 5.5 million people, and like the other Nordic countries that surround it, it has what's usually called the Nordic model, which combines free capitalism, capitalism with a comprehensive welfare state and a very strong worker protection, so very strong worker protection laws. And in Wikipedia Denmark, which I actually did, you're told that Danes enjoy a high standard of living. The country ranks quite highly in terms of education, healthcare, protection of civil liberties, and governance. The country also ranks as having the world's highest social mobility, level of income equality, perceived level of corruption in the world. It also has one of the world's highest per capita income, but very importantly, also one of the world's highest personal income tax rates. In country, I think the last survey showed that only about 19% of the population say it's an important part of their life. Universal healthcare system characterized by being publicly financed by this very high tax rate. And for the most part, these services are free at the point of delivery, and they're kind of provided directly by the regional authorities. Denmark, there are 4 medical schools, 3 of which have these dissection programs. They're located, as you can see, in Copenhagen, in Aarhus, and in Odense. And all bodies there are obtained solely through donation. signs are used for various purposes in Denmark, as they are across most of the world. They're used for research, they're used for producing anatomical specimens, postgraduate surgical courses, and as dissection material, of course, for educational purposes within medicine, within odontology, physiotherapy, etc. So that's a fact you might keep in the back of your head as I continue the talk. So I am pretty much trying to cram everything that I do within anatomical dissection into this talk, which might be a bit much, but I've attempted to make a model to perhaps make it more understandable, hopefully not just more confusing. So my work, both the work that I have done and the work that I'm doing now, really tries to take different kinds of perspectives to look at anatomical dissection. And the way I work is very much grounded in the empirical. So I thought myself when I started this project, if I want to understand anatomical dissection as a phenomenon, as a social science researcher, not as a medical professional, where do I actually go? And I thought, well, I should start off by going into the lab where it is actually practiced and look at these practices through doing ethnographic observation. It really only accounts for half of the equation, doesn't it? It only accounts for the people in there who are living, breathing bodies. It really doesn't account for the bodies who are dead that are in there. And I really wanted to know how they ended up in the dissection as well. So conduct interviews with whole body donors. I then realized that this is a very particular historical thing. And it's quite a new thing, actually. It's only come into being in the 1960s, 1970s. I'm quite interested in figuring out the history of anatomy in Denmark, where bodies come from before the donation was an opportunity and before donation was something you could actually do. So I did a historical analysis that I'll tell you more about, where I looked specifically at supply of bodies through the time. Here now are basically what made up my PhD thesis, which I defended, as Sabine also said, in 2015. What I'm working on is tracking future developments within anatomical science, with a special focus on how to see these developments. But all anatomy evolves as a science through the years. So all these things together, you can see that what really interests me looking at the conditions and implications of anatomy through the times in the past, present, and future. And those two threads, which I don't know if you'll be able to see all the way at the back, but I look at the change in supply of bodies that takes place over time, and I look at the changes in anatomy that takes place over time. What the rest of my talk will basically be is to try to delve into some of these bubbles up here, basically this row right here. Start by, in the present, by taking you directly into the dissection lab. Now, I know the people here have probably spent time in the dissection lab, but this is, of course, the social sciences view of what goes on in dissection labs, you might say. Here is based on ethnographic fieldworks and interviews conducted with medical students and staff at the medical schools in Denmark, the 3 medical schools in Denmark. Pretty much anatomical dissection courses, observing surgical training courses, and just general hanging out in dissection labs. As an ethnographer means, of course, observing dissection, talking to students, and also trying out dissection myself. That's why it's called participant observation, right? The time in the lab, what I really wanted to pay attention to was the encounter between cadavers and students. Something I found, and which I'm sure will not come as a surprise to any of you who have actually spent time in the dissection lab, is these cadavers are very ambiguous entities. Some they are like persons. For instance, when you look at their faces, when you stumble across tattoos on their bodies, when you find remnants of nail polish on their fingernails. And things you learn from, models, you might say. Sometimes very strange, sometimes they're eerily familiar. Done on this work, and which is in press as we speak, explores how students go about dissecting these ambiguous bodies with respect. That dissection really takes place at an intersection between, on one hand, the fulfillment of these medical pedagogical aims, and on the other hand, the execution of the wishes of the donor. This intersection places the students in what for some of them really feels like a kind of double bind. They have to remain, but at the same time they have to dissect the bodies in order to learn, and in order to actually fulfill the wishes of the donor who wanted them to dissect their bodies. And what, for anyone who's interested in reading more about it, is explain how students concretely in practice grapple with how to do this, how respectfully. And that you see in the picture actually a role in this kind of negotiation of how to dissect whilst also being respectful to the deceased. And I leave a short excerpt from my field notes for you. Meticulously scrapes all bodily material that she has gathered in a tray into the yellow bucket at the end of the table, taking time to make sure that even the smallest bits of tissue end up in the bucket. That's a good way of doing it. So it is with the rest of the body, and the family can get it if they want. It's a big deal that someone has chosen to donate their body, so we learn by cutting in it. Therefore, it's important with respect around it. Student attempts to balance these somewhat contradictory demands that dissection places on her, and we, even as she is kind of working with cutting this body apart, she is considering the cadaver as a person. She is considering the relatives of the deceased, and considering the fact that the body on the table arrived here through will donation. The article argue is that this encounter between cadavers and medical students and the experiences with trying to work out exactly this thing of work of dissecting respectfully may be seen as a kind of practical ethics training, which affects on the kind of medical doctors that students become, and the kind of care future patients are then in turn afforded. This is not anatomy. So going into the labs, highlighted not just what is done to cadavers, but also what cadavers do to the living. The effect on the medical students who dissect them. This counter is shaped by the conditions of supply of bodies. It's shaped by the fact that these bodies willfully want to be here, and what I will turn to now. So, staying in the present, I want to turn to those who donate their bodies to science. Together with and my supervisor back then, Professor Klaus Høyer, I like to understand how Danish whole body donors make sense of their decision to donate. So we interviewed 13 full body donors as part of a larger project. Donors think and feel about donation really pays attention both to the conditions of dissection and to the implications of an anatomy. So that people make themselves available is a necessary condition, of course, for dissection to take place. But at the same time, this possibility of getting your body to dissection post-mortem actually has effects on how donors think about their bodies, how they think about their social relations, and how they think about their place in society, their societal relations. Logically, this attention to the sociality and culture, not just as the backdrop of anatomy, but also as the effect of anatomy, made us move beyond an investigation of what motivates donors to think into an exploration of what it means for donors to donate. To investigate the lives of donors is not just something that comes before the decision to donate, but also something that comes after the decision to donate. Again, a kind of interweaving of anatomy and society. So in interviews, what we found was that the decision to donate is really inscribed into the ways that donors live their lives, and see this act of donation as a meaningful act, resonating with the experiences they've had, values they hold dear in life. one of these experiences that is often highlighted is their experiences as patients in the healthcare system, in the social care state. Offering donation as this act of gratitude towards the system, and really taking steps to make sure the donation happens, as you can see in the picture on the slide as well. So this is actually a picture of a tattoo that one of the donors that I interviewed has. Interestingly, he didn't have it when I met him, but he called me sometime after the interview and said, "Do you need a picture for your PhD?" I said, "What do you mean?" He said, "Well, I just got a tattoo." And he kindly sent me this picture. The tattoo reads organ and body donor in Danish, and the phoenix rising from the ashes, symbolizing the life and knowledge that his own dead body might give rise to through donation. In order, we see some of these same ideas. So his reasoning behind donation, he said, "Body be of benefit. Thank you for the treatment I have received in the Danish healthcare system. How could I repair my heart? How do you do those things? They can do it because they have studied, because they have dissected, because that make themselves available, and so on. We owe the healthcare system. We owe science. We owe it research to do what we can without it harming ourselves or our next of kin." Donation is not a sacrifice. It is an act shaped also by the donor's relationship to the medical profession and by their relationship to the state. A relationship between citizens and medical profession and the state is actually also the focal point if we move back into history, which is now. So the third I want to take here today is that of understanding the history of anatomical dissection. And analysis really underscores the political and moral space of anatomy and underlines how donation is a very particular form of body supply, which really is only intelligible when seen in its historical and cultural context. It underscores how there really is nothing self-explanatory about people willfully giving up their bodies for dissection. There are still also other national contexts where dissection of the human body is not a viable cultural way to plan our afterlife. If people want it for themselves, historically, and in some places, it's still not what people would want for themselves. So the historical analysis of Danish laws, especially from the 18th century, dealing with the supply of corpses for dissection. And what it has to do is to render visible a national policy of corpse supply that made certain corpses usable up through the 18th and early 19th century. And these were for bodies of executed criminals. And then the early 1700s, also bodies of the poor who had received help from the state. One article is I connect this to the professionalization of surgery going on at the same time. So what implies is that at this time in history, medical doctors and surgeons are two very different things. Medical doctors are educated in the university, and the so-called bar surgeons of the time were, true apprenticeship. However, during the early 1700s, surgery now becoming established as kind of a professional discipline of its own. And this specialization was in no small way connected to anatomy, and it was seen as kind of the groundstone of surgical knowledge. Cadavers were now in demand. And now you have two competing professions that both want bodies. Actually, they were not, the medical education and the surgical education were not merged until 1842, I think, in Denmark. So they kind of stayed on different tracks, were taught in different institutions, etc. And they both wanted bodies and fought over those bodies, actually. King, who was an actually helped establish the surgical academy. He did a series of laws, and he did it through financial help. So 1736, for instance, provided buildings, one of which you can see dissected, as it were, up here. It also provided instruments, and it also stipulated the corpse supply for the new surgical academy. The law, interestingly, also explains the reason for providing these things and for establishing the surgical education as a new profession. So in the law, you can read that the reasons for making all these things and all these bodies available are so that there may always, in the royal lands, be experienced and proficient surgeons, subjects, as well as the army's needs. So we can hear how the decision to make available bodies of not just criminals, but also bodies of the poor, were connected to King's wish for competent surgeons to care for his population and army. It was actually connected to a nation-building project, you might say. What history does so well here is that it makes us ask new questions to a present that may otherwise seem self-evident. It would pay attention to the supply of bodies and to understand it in its broader cultural context. So why to make donation a culturally intelligible decision? It reminds us to ask what kind of wider project anatomy is part of, what kind of world does it partake in shaping, what kind of good is envisioned as the end goal here. And are also kind of the focus move into the current developments in anatomical science. So I'm leaving the moving to the future. Both the future of anatomy and the future of my research. So this is very much work in progress. I'm not even done with all the interviews that I'm doing for the project, but I wanted to bring it here today anyway to kind of get your ideas on this very finished work. What I'm attempting to do in my new project then is to take point of departure in current developments within anatomical science, as well as the articulated visions for what anatomy should do in the future, both in and globally. These donated bodies to medical and perhaps even social data collected throughout the lives of these donors. Now, especially, that is potentially very extensive. So, a Danish citizen has what's called a CR number, which is this unique personal identification number. That number is basically used every time you have an interaction with the welfare state. So every time you use the medical system, every time you use the social welfare system, every time you pay taxes, everything is registered and connected to that one unique identification number. We basically link these donated bodies to a multitude of medical and social data collected through all their lives. Development is the increased cryopreservation of blood and tissue samples, where these samples may be used for research, decades later. This kind of research includes also doing genomic sequencing on these donated tissues. This point to potentially indefinite storage and use of tissue and data, which might lie outside of what donors imagine. So what then, of course, was to explore what donors think about these matters as they're kind of thinking. On a level, the interviews that I have conducted so far seem to suggest that Danish donors are not greatly worried about the prospect of linking their body to this medical and social data. What we're worried about is the loss of control over what this data might be used for in the future. Time have changed, or maybe when technology may have advanced. Some people said, I don't care, I'm dead at the time, it doesn't really matter. Others were really, really greatly worried that data might fall into the hands of the wrong people, and the wrong people for donors are generally medical insurance companies. Are not a big thing in Denmark, but which is something Danish citizens are afraid might be coming. It's also things like medical industry. And the government really told how she was worried that her data might be used for research purposes that would upset the equality of the social welfare state that she's grown up in. What if this leads to inequality? She didn't want that to happen. At the same time, she also felt that it was difficult to know in the present what she would want to consent to in the future after she had died. And a point, because obviously when we're dead, we cannot reconsent. We opt out. So this becomes who should be responsible for making these decisions on behalf of donors, who should be the custodians of their afterlife. Governments thought this should be handed over to future generations and the general public opinion, whatever that is. Others thought it might be medical staff, policy workers, but people were quite undecided, you might say. And there seems really to be no agreement on these kind of matters, no matter if you ask policymakers or anatomists or the donors themselves. this is something I want to pursue further in this kind of analysis. It should also be said that several donors expressed a great amount of trust in the medical profession and were not worried. So for informant responded in the following way when I asked him whether he had any concerns about the prospect of his data being stored and used for research after his death. And he says, what I think would be fantastic if it could contribute as part of the overall package. For me, it's all inclusive. And good thoughts along the way, too. Content about parts of his body being stored, enthusiastically talking about parts of himself, quote unquote, in glass jars, lined up for everybody to see. Expressed similar notions, one female informant, for instance, saying she was hoping to make a career as a cadaver, hoping they would keep a lot of her and really use her to the fullest extent possible, asking me, do they also, kind of boil the meat off the bones and keep the skeleton? No, they don't. Oh, that's a shame. So, all the donors are greatly concerned with kind of living on as data or living on as body parts. Still stressed that the important part was the purpose, that it had to serve a meaningful purpose. And if purpose, then it really didn't matter if it was body parts or data, and for how it was kind of stored. In connection, several actually imagined that both their medical records as well as information about their social life might be relevant for both medical students and researchers. And the informant explained it would perhaps be interesting if they were to go in and take out some pulmonary veins and then open them, because I have worked with asbestos and chemical laboratory industry, so PD today, and that might to a large degree stem from that. Others echoed this kind of reasoning, detailing the kinds of life their bodies have gone through and how the marks of lived life on their bodies might be more relevant if data about their lives would kind of follow their bodies into the lab. So first, data was actually seen as making the decision to donate even more meaningful. It was contributing to the kind of extending one's agency beyond your own death. Like with the views I did with donors, we see this kind of interweaving of the lives donors have lived with their decision to donate and visions of their afterlife and the legacy they leave behind. So what I'm stressed then, just to kind of drive the point home here, is the meaningfulness of donating your body to science. And I just include one more donor story here. So one donor that I interviewed had an adult son who was also a body donor and who actually died just 2 weeks prior to my interview with him. He was, of course, he was still grieving very much over the loss of his son, but explained to me how dying at the age of his son was not meaningful. How it's never meaningful, but how it had actually been a comfort to him to know that his son's body was then brought to the anatomical department and was put to good use. Then there was some meaning in death. Seen in light, it is perhaps understandable that the exact usage of the body, that the exact kind of what data comes along with it is not really that important for the donors I speak with. Issues still remain, right? How do we also account for these uncertainties and these ways related to these developments? And we start by turning to a specific case. How much time here? Wonderful. Wow, perfect. All right. So take this case then before I move to the conclusion. So we might have a specific case where these technological possibilities are kind of changing the utilization of donated bodies, and one such technological development, of course, doing genomic sequencing on these donated cadavers. So doing these genomic testing, the dilemma arises. What if these genetic tests reveal hereditary disease or a condition which might affect the deceased descendants or relatives? What with such information? And really, positions of this are quite varied so far with donors that I interview. Some donors feel that it's unethical to release any kind of information, especially if the condition is not life-threatening or if the condition is not treatable. And an informant, for instance, says, so I don't think it's right that they're told. If I was alive and I could tell them myself, told anything after my death. Now, this informant finds troublesome is not that his descendants should learn about a genetic condition per se. What he finds troublesome is that he himself who makes the decision to tell them. I think this loss of control over what kind of legacy or aftermath happens after you're dead and your body goes into the care of someone else. The scale, I had a male informant who said it would be a crime from the hospital if they know and they don't tell the family. So you kind of varied responses. Now, this informant was a very interesting character. He placed great hope in science. He placed great hope in the future of genetics, although he didn't know a lot about genetics. He hoped research into genetics might teach us not just about disease, but about what he called the very human condition. He was a very religious man. He also felt that we as humans should not hold back from enhancing what he called God's creative work. We should manipulate genes to make life easier for people. And he, in the following way, and this is quite a long quote, but I just really like it, so I brought it anyway. I think that at some point you might find something there in the genes, and if you could go in and help those who have problems, not that it all be exactly alike, but it all go through life equally easily, but there are some who have to carry so heavy a burden in their life that it is unbearable. And if them and the body could help them, if you genes, tissue, find something, why wouldn't that be great? I have patients that they have to do that, but you just never know what they might be researching and what kind. And in the case, I just say, and then he actually stood up and he did like this kind of a very Jesus kind of thing, position. He said, "Here you go, I made myself available to you. Can you use it for something?" And then he sat back down. Donate includes a vision of helping future generations. This is a very consistent find among both these donors and the donors they interviewed for the pre-project. Donor in particular, this wish for helping future generations almost seems to kind of override any kind of personal worries he might have about what his body is used for. But, expressed more worries about what their data and bodies might be used for, given this extended time, given the uncertainty that kind of follows from that. So there are answers to these dilemmas, but I'll put them into a larger historical perspective as I attempt to conclude my talk today. So this is the last slide. I'll just take some water for it. What I take away from this kind of tour de force through the past, present, and the unfolding future of anatomy? Understand anatomy as situated in and contributing to society. So in of kind of the development through history and into the future, and they reflect societal and cultural norms that the society holds, but it also pushes these norms. It also acts on these norms. It's just a medical phenomenon, but indeed a cultural phenomenon. Available thus rests on certain political systems, moral convictions that make certain forms of body supply possible and legitimate. But using dead bodies in this manner also then has implications for the moral and political state, as making oneself available becomes a possible way of expressing societal relations, of expressing a wish to influence future healthcare in society. The four roles I've kind of gone through. If we start with the first one, going into the labs, we saw the ways in which students in words and actions try out these kind of different ways of engaging with the cadaver is shaped by the conditions of body supply. The bodies come from donation places the students in a kind of reciprocal relation, where they take the gift of donation seriously. And seriously, both treating the cadavers with respect, but also dissecting them. And it's this constant negotiation that I talked about how that looks, how dissection, or how respect looks in a dissection. We see the decision to donate is often conditioned by the way that donors have experienced being a person or a patient in a system which the donor generally characterizes as helpful and always there for them, inhabited by caring, compassionate doctors. This reciprocal relationship, where is connected to a feeling of gratitude, a way of repaying for help received, and to contribute to future treatment of patients. Making body available then becomes a way of relating to society and kind of fulfilling almost a citizen role. And that this with moral meaning can be seen in the ways that donors are keen on letting values that have been meaningful in their life characterize their afterlife. Donation understood then as kind of the legacy, the physical and moral legacy that donors want to leave behind. Moving on, the certain bodies available for dissection contributed not just to the professionalization of surgery, but also to the aims of the state, as I said. In the law, see how it's connected to the king's wish for surgical staff to care for his people and army, building a wealthy and healthy state. To understand that these are not just political aims, they also actually kind of moral aims, you might say. So, up the century, as the state became increasingly preoccupied with caring for its population, it also providing housing, benefits for the poor, and seen in light the appropriation of these bodies of the poor for medical dissection can actually be seen as kind of stepping stone towards providing medical care to people who had otherwise been undersupplied. So these students that were actually trained in Copenhagen based on these bodies actually traveled around the country giving medical care to people who had never had medical care before. So I would argue that making available the bodies of the poor is always unjust in terms of taking advantage of the marginalized group. It was not driven by moral values and a sense of the good. We can discuss is whether we agree with this sense of the good. It's interesting to note that the bodies of the poor which were made available were not just bodies of all poor people, but specifically the poor who had received help from the state. So although 18th century society was, of course, far from being this democratic society that we have today, it's interesting to note this kind of parallel between, help and that you then give your body either through force or through donation. So there's this reciprocal relationship that's kind of always being articulated thoroughly, and now takes place, on a more individual level. Final visions of the future of anatomy, what we see is actually a donor population which generally expresses a great deal of trust in the welfare state, a great deal of trust in the medical professionals that they leave their bodies to. These believe in science. They're people who want their bodies to be put to use. However, if we see it in the historical context, I think it would be unwise and wrong to mistake this enthusiasm for cardiologists to do whatever we want with these bodies. Although they may not care about its exact usage, they care deeply about the society of the future. That is exactly why they donate their bodies. They do worry about the prospect of their bodies being used for research that undercuts the society that they want for the future. It reminds the values they care about. To help future generations, they want to help educate skilled and compassionate medical professionals, and they want to do their part to create a society based on the values that they hold important. And that they envision for the future is a society of scientific progress, but also a world of social solidarity. It's a world of reciprocal responsibility between citizens, medical professionals, and the state. So, finally, anatomy is a science that depends on society. It depends on the supply of willfully donated bodies, and a science which includes a practice that in all other instances would be considered illegal and taboo. And it is then a science which depends on, but also shapes our societal moral values. Important, I think, to keep asking what of the goods that are articulated in development of the science if we want to keep trustworthy and ethically sound relations to society. Thank you.
Thank you so much, Maria, for this fascinating talk. This rich work, I wouldn't know where to start discussing because everything seems important, exciting for me. But questions from the audience. Yes.
Thank you so much for this talk. It's wonderful. I'm a physician, and coming from, I did the anatomy lab about 15 years ago, and that educational experience speaks a lot to that. I am curious how you have, particularly from medical students or residents or trainees, about sort of the anatomical dissection in medical school as sort of one arc in this kind of life continuum of grappling with anatomy and as it relates to death and meaning. Just a couple examples of that. One is when I think back as to sort of foundational for me in medical school, it was the dissection was like literally the first few months of medical school. And so it was sort of hard to remember. It was sort of a whirlwind. Later, we did a number of, throughout training in medical school, we did a number of autopsies. And as you are aware, in the United States, post-mortem autopsies have declined dramatically for a number of different reasons. And so I'm curious, and then asking patients particularly during residency, or his family to sort of post this core sort of intern thing you learn is how do you ask a family once they're in the minutes after their loved one has passed, whether they would choose a postmortem. The sort of relation to organ donation, which also sort of from a societal perspective, in the United States, people identify as living organs, which is separate from the piece of donating your body to sort of scientific or medical education purpose. At least that's my understanding as an American. As an expert on this. And also from a medical education standpoint, the other one, when particularly in my pediatric training, where there are children who had catastrophic events, and they were basically alive to harvest their organs to save other person's lives. And so there were these many other aspects that are related: autopsy, living donation, organ donation to the dissection. What are your thoughts on that?
I have many thoughts on that, but so the interviews I did with donors were part of a larger project, which also interviewed people who had decided to sign up as organ donors, and people who had decided not to do anything, to try to kind of get different positions on this and to be able to compare, the difference between giving your entire body to science or giving just a few organs. So from a donor standpoint, these are quite different populations, really. And policy standpoint, they're very different as well, I think. So for instance, in Denmark, there are lots of laws governing organ, but only like one sentence governing anatomical dissection, which is different in the U.S. I think. Denmark, that's the case. And there's something also about the public life, I think, of these. So something like organ donation is something you run into all the time. There are campaigns for donation. When I don't know how it is in the U.S., I'm not exactly sure, but some places when you get a driver's license, you're asked to. You do that in the U.S. generally?
Yeah.
There are posters and there are campaigns and there are all kinds of things. And you are saving a life and all of that. Well, there's no campaigning for bodies generally anywhere in the world, basically. Different kind of publics as well, which I think we find really interesting. And medical autopsy, I think, has no public life. People don't realize until they're asked at some point, at a point in their life when it's perhaps a bit difficult to make this kind of decision. And so in Nordic, you can actually make the decision if you want to be autopsied in a medical hospital as well. Before, so we have the red, kind of organ donor card, then you have the blue autopsy card, and then you have the will for whole body donation. There are like 3 different kinds of systems. But nobody really knows about the blue card. Nobody really knows that they can do this. So I think there's, and it's really part of seeing this as not just a medical phenomenon, but a cultural phenomenon. So there's very different kind of cultures. I think these different usage of bodies. I don't have any good answer as to why that is. I think it's historical reasons. I think the donation community has been really good at kind of branding what they do, basically, and it's perhaps also easier for people to understand. You take an organ, it's put directly into another body, who then springs to life. That's a very different than you lie on the table and people cut into you.
So it's a resurrection, basically.
Yeah, and along the lines, at some point, you become a surgeon who will then. It's a very different kind of vision for a lot of people. I answers your question.
But the question is whether those things should be linked.
Yeah.
At my age, you want to donate your organ.
Mm-hmm.
Probably nobody will take your organ
Mm-hmm.
at a certain age.
Like,
Maybe you could
yeah.
say, if my organs are not
Yeah.
viable, then I would like to be.
But then you move into, and I think someone like Stefan Timmermans from UCLA has done work on how you then also have professions starting to fight over bodies, basically, right?
Yeah.
Then who gets to decide whether this body has organs that are good enough? What if it's not an entire organ, but just a heart? Is that more important than giving the entire body to science? So I think it could be done, but there then different kind of institutional politics would definitely go to that. Would perhaps see this fight over cadavers that we saw historically in the 1700s, which is not pretty either. So I don't know, exactly what would come out of that, but it would be interesting to align them more.
We have another question.
Well, thank you for the informative talk. I think you so eloquently explored and elucidated the question of what we're donating, right? And I think it was very learning that it was in fact not because of sacrifice, but rather due to it that it was donated.
Yeah.
Also historically, you not even historically, you also explored what was being donated, right? The specimens of bodies and body parts and everything else. But historically, you talked a little bit about who was donating. What about now?
What about
Southern strata? Where do these people fit?
Yeah.
Help me live the experiences of these people that you're thinking about.
a good question, and unfortunately, the registers for the donors are not allowed to be used for research. So basically, I'm not allowed to look at them and figure out who they are, which is really annoying. I'm working on trying to get access to kind of different ways, but let's just take people I have talked to. Then it's not representative, but it gives kind of an answer, I think, to your question. So basically, there is no population in terms of social strata. There is no population in terms of religion. There's no. They're very, very, very people. So I've spoken to professors. I have spoken to policemen. I have spoken to factory workers. I have spoken to people who've been social welfare most of their lives. So they're very kind of different people. Some of them are highly religious and see it part of like a Christian duty, for instance, to give their bodies. Some are atheists to a degree where it's almost very, and see it as part of, the body is just a body, it doesn't matter. So really share any characteristics, like social characteristics. What they do share is this a view that they won't need their bodies in death. That's what unites them. And the other thing that unites them is definitely this kind of towards society and like that kind of reciprocal relation. Those basically the only two that unite these people.
Yeah, this is what we anecdotally actually also know from the United States, that there are actually, really all walks of life are represented within our population of donors. However, historically, we have certain part of the population that donate not quite as frequently, probably because of historical racism. So we have less African American donors. We have hardly any LGBT donors, as far as we know. So these are historical reasons, and I think here is where the next part of the work will be in the 20 years, to look at national differences.
Yes.
Here, right?
So actually, just touching on the LGBT, I actually did an interview just before I left for this, with a transgender person who very connected her decision to donate her body to that history, and wanting to kind of push the medical science to see bodies that look different from the standard body.
So we had one in my experience of 16 years with dissection. I saw one.
So people put their own agendas into this as well, I think, which is really interesting. Again, it kind of reflects, their values and what they find an important legacy to be behind.
Scott?
That's actually almost the same question. And so there's no U.S. data either? And then does or could HMS do that?
Pardon?
Could HMS do that type of questionnaire with
We could do a lot if we had people who, supported this kind of work. We would love to.
Yeah, I'll come and do it.
Thank you for a wonderful cross-cultural exchange. One of the thing I was going to ask you was, how is anonymity for the donors that you so that
It's an important thing.
from the program where we receive the to other programs where and make the donors know who the effective family
Yeah.
and friends.
Yeah.
So, I mean, and that's also an obstacle to making good.
Yeah. So, and the number of the donors I've spoken with, but I think this touches on the trust issue. So they think, of course they won't. Medical professional. I mean, they might just be students, but they're good people. They won't go telling anybody who they dissected. Very kind of
Get very different answers in Germany. Trust me.
I think really these are national responses. You really have to understand the national history to understand that kind of response. But they really don't care. So I also spoke with about memorial services and things that which we do not have in Denmark at all for donors. And outright kind of stupid. So they said, that's not why I donate. I don't want to be thanked. I don't want to be kind of congratulated or anything like that. But they are very welcome to see all my stuff. But I don't want to be kind of seen as a hero or seen as anything like that. That's kind of wrong. I do this out of gratitude and kind of tilt system, and they can have all the data if they want. They can know who I am because I trust them. But I don't want this to be a personal story about me. No. There's a complete anonymity. It's like a complete, yes, in Denmark at least, yeah. And everywhere else they receive celebrities. There's actually quite a lot of celebrities in Denmark that donate their bodies to science, which is weird. Yes, but and they're always used for research or surgical training courses. They're not used for medical students because you don't want to tempt someone to go say, oh, who I just dissected? This is this actor. Yeah. So there's definitely like a anonymity politics. It seems much more important to the staff than it does to the donors, which is always kind of interesting, I think. Yeah.
Lisa, we have
I'll
to.
talk to you afterwards.
Yeah.
I'm trying to teach anatomy in my area, but
Yeah.
I think my question is, if they're connecting genetic data and that goes into a bank,
Yeah.
there's a possibility that somebody who wants to verify their paternity,
Sure.
or
All kinds of things.
whatever thing,
Yeah.
and if happens, people who donate bodies and agree to whatever, is that one of the decisions that they're nervous about?
That doesn't up as a question. I think what has come up is more the idea of hereditary diseases and things like that. That's really kind of what we talk. And that's really the only reason they're afraid of the genomic data. They don't care that there's but they really spill over into the lives of the descendants, right? So they say, I don't care, they know about me, but I don't want it to affect those behind. That's basically kind of the distinction most of these donors make, if that makes sense.
Question. You're donating firm or whatever.
Yeah, sure.
Your family finding out.
But I think this is exactly what your project tries to actually explore, right?
Yeah, what matters to people here. Yeah.
Unfortunately, we have to stop here. This has been fascinating. Thank you once again.